Imagine this. In the next 20 years, Australia's over 70s population explodes by nearly 68%. That's 2.3 million more older people needing your nursing skill right now. New grads, transitioning nurses, future leaders. Are you ready to master Australia's aged care system? Welcome back. You are tuning into the Aged Care Nursing Journey podcast. From our experience to your success, I'm the founder and host, Andu. If you are new to the podcast, a very warm welcome. Please take additional minutes to watch or listen to the introductory episodes to get to know me and my background a little better. In this podcast episode, we're going to explore understanding aged care in Australia. It's really a guide for nursing students, new graduates, nurses transitioning into the sector, and frankly, anyone trying to navigate the aged care system. So, whether you're stepping onto the floor for the very first time, or maybe you're looking to move into a leadership role, getting your head around the big picture of how the system works, well, that's absolutely the first step to mastering it. If you are ready, let's dive right in. Alright, think of this as our guided expedition for today. We're going to cover the Australian context, then the spectrum of care. Then we'll go inside residential aged care. After that, we'll get into governance and some major reforms, and we'll finish up by looking at your nursing career path. Okay, let's get started with section 1, the Australian context, and why it matters so much. To really get a grip on aged care, we have to start with the why. Why is this sector so critical, and why is it growing so fast? It all comes down to the demographic landscape, and that's our essential first step. Let's just take a look at this projection. According to the Australian Institute of Health and Welfare, the number of people aged 70 and over is projected to jump by nearly 68% in just the next 20 years. That's huge. That rising arrow really tells the whole story, doesn't it? It means a massive increase in demand for skilled aged care staff is not just coming, but it's right around the corner. So, with that incredible demand in mind, the big question is, how do we actually deliver care? Well, the system offers a whole range of options, and it's so important for us to understand the main pathways available to older Australians. So, let's map them out. Alright, when it comes to aged care, it really boils down to two main roads, you could say. First up, you got home support. This is all about community-based care to help people stay in their own homes for as long as possible. The Australian Institute of Health and Welfare tells us this is what most older Australians really want. Then you have the other path, residential care. This is for when living at home just isn't safe or practical anymore, and that round the clock 24/7 support become necessary. Now, this is a big one. Since the 1st November 2025, Australia has undergone a massive shift in aged care with the Support at Home program, replacing the Home Care Packages, HCP, and Short-Term Restorative Care, STRC, program effective 1st November 2025. The whole idea here, as the Aged Care Quality and Safety Commission explains, is to create a simpler, more streamlined and flexible system that really supports people to stay at home safely. So here's a super practical tip for you, especially if you're new to the aged care sector. You are going to hear both the old and the new language out on the floor. You have experienced staff who might still talk about home care packages or HCPs and CHSPs, but all the new paperwork and systems, they're gonna say support at home program. So, knowing both is absolutely key. It's gonna help you communicate clearly and practice safely while we're all in this transition phase. Alright, let's move on. We're going to step inside a residential aged care facility and take a closer look on the ground. For so many of you listening, this is the environment where you'll be putting all your incredible skill to the test day in and day out. And just to give you a sense of the sheer scale, we're talking about the Productivity Commission reports that the occupancy rate in residential aged care is sitting at around 88%. That's the highest it's been since 2020. I mean, think about that. That incredibly high rate just goes to show how vital this part of our health system is. We're talking about a system that's home to hundreds of thousands of older Australians at any one time. I really want to be crystal clear about something. This is not simple care. It's not just aged care. Let's look at these numbers from the Australian Institute of Health and Welfare. Just over half of all permanent residents have a diagnosis of dementia. Nearly 60% of people coming into care have a mental health condition, and a huge proportion of residents are over 85. This is a highly complex, high acuity clinical environment that demands top-tier nursing skill. Full stop. So who are the incredible people providing this complex care? Let me tell you, it's a real team effort. You got your personal care assistants, your enrolled nurses, and of course, registered nurses. But one of the absolute greatest strengths of our workforce and Gen Aged Care data really highlights this is its amazing cultural diversity. Around half of all employees in aged care were born overseas. How incredible is that? It creates this rich, multilingual, and multicultural environment that really mirror the wonderful diversity of Australia itself. You know, they say it takes a village. Well, it absolutely takes a village to care for our elders. This really shows how nursing is at the heart of it all, but we are just one part of a much bigger multidisciplinary team. You got lifestyle, catering, administration, maintenance. Every single role is like a vital gear in a machine working together to support our residents' independence and well-being. Next up, governance and major reform to work effectively, and most importantly, safely. We absolutely have to understand the framework that governs our practice. Let's think of this as learning the rules of the road for aged care. So, there are really two key players you've got to have on your radar. First, there's the Department of Health and Aged Care. Think of them as the system governor. They set the big policies and hold the purse strings. Then you have the Aged Care Quality and Safety Commission, or the ACQSC for short. They are the regulators. They're the ones on the ground, making sure providers are following the rule and that quality and safety standards are being met. And all of this is underpinned by some really significant legislation, including the new Aged Care Act. Now, this is probably one of the most monumental shifts the sector has seen in decades funding. We have moved away from the old model, Aged Care Funding Instrument, which was called ACFI, that was very task-based, and resident care funding was tied to specific tasks. Now we're on the Australian National Aged Care Classification, AN-ACC model. That's the Australian National Aged Care Classification. And the fundamental difference here is that the Australian National Aged Care Classification is all about a resident's needs. Funding is determined by an independent assessment of what a person actually requires. It's a much more person-centered, clinical, and welfare approach. Section. Let's bring it all back to what section? let's bring it all back to what matters most. You. Let's talk about your nursing career path and how you can take everything we've discussed and turn it into a really thriving, meaningful career. Let's be honest about one of the sector's biggest challenges: workforce shortages. Here's the thing, that challenge is also your single biggest opportunity. Yes, there's a significant shortage of nurses, but what does that really mean for you? It means you are in a high demand. It means your skills, your critical thinking, your clinical judgment, and your leadership potential. They aren't just appreciated, they are absolutely essential. You are needed. This incredible demand, it just blows the doors wide open for so many different career pathways. Please don't think aged care nursing is just one thing. There are amazing opportunities to step up into clinical leadership, into management roles. You can become a specialist in really crucial areas. Think dementia care, palliative care, wound care, infection prevention control lead, clinical assessment coordinator, or maybe you want to shape the next generation of nurses by moving into education. The sky is the limit. Look, this isn't just talk. There are real tangible pathways for growth. This gives you a great visual of how that progression can look, starting as a carer and moving all the way up to a general manager role. And what's so great about this is that these leadership opportunities aren't just for registered nurses, RNs. They're open to people from all different backgrounds. There is genuine, achievable potential to build an amazing long-term career here. Let me proudly share with you this. I have successfully mentored and coached both clinical and non-clinical team members to step up to the management positions. So, if there's one single message I hope you take away from our time together today, it's this: aged care is not a checklist of tasks. It's not just medications and paperwork. It's about connection. It's about building relationships. It's about having the incredible privilege of caring for a whole human being, someone with a lifetime of stories, wisdom, and experiences. So now that you've seen the reality of it all, the complexity, the high clinical acuity, but also the incredible, profound opportunity to grow, to lead, and to make a real difference, the only question left is, are you ready to embrace this meaningful career journey? I hope this podcast episode has provided some insight into the machinery of our sector, moving beyond the task to understand the system itself. Please help us to expand our community by leaving a review, liking, sharing, and subscribing to the podcast. You can find us on Facebook, YouTube, Apple Podcasts, and Spotify by simply searching for Aged Care Nursing Journey Podcast. Thank you for joining me and for supporting the Aged Care Nursing Journey Podcast. Let's empower each other and walk together in this journey, which will convert the podcast series to a platform where you ask, I share, we learn. See you in the next episode, where we can together explore an organizational structure which illustrates a staffing structure in a residential aged care setting. It's commonly named as the team at a residential aged care home, facility, or village, and also highlight your career opportunities. Take care and goodbye for now.